Hello, everyone. Thank you for joining us. We'll go ahead and get started in about 2 minutes. All right. Thank you, everyone, so much for coming today to our monthly webinar series. So today we are going to talk about substance use, specifically what is happening here at DPS, including kind of some data from our Healthy Kids Colorado survey, and what our substance use prevention program is doing in the district, and what you all as trusted adults can do to support the students in your life. So to start with, a little bit about our team. So we are all part of the DPS Substance Use Prevention Program. Our program was started in 2015 as a kind of a reaction to the legalization of recreational marijuana. So we are a DPS program, and the goal of our program is really just to prevent or delay substance use, and then also reduce use for students who are already using. And we do this by giving students tools to make healthy decisions. So that can be education about specific substances. It can also be tools to help students with anxiety, to help students with coping when they're going through something rough, to help them make connections with other peers in the school and trusted adults. And all of those things we know are going to reduce substance use in our students. Currently, our program has staff in 26 middle and high schools, which is great. We started, like I said, when we started in 2015, we were in 3 schools. So we have since grown to 26, which is great, but we have over 200 schools here in the district. So we also have a training project. And through this training project, we are able to pay to train staff, existing staff in buildings, to implement programs. And we're also able to pay for those programs. During the 2020-2021 school year, we reached over 12,000 students. This was in the middle of COVID, so it was challenging. It looked a little different, but still great. And then this year, and we're going to talk a little bit more about this, we have a brand new program called Project Divert, which has really begun assisting schools by providing guidance and support for alternatives to suspension, and also addressing the disparities that impact students of color. So with that said, I'd love to introduce our amazing panel of, that we have talking to you all today. So first of all, we have Megan Michio. She's a school health professional at Thomas Jefferson High School, and she's also on our training team. We also have Omar Reyes. He is the program manager of diversion and substance use prevention, and that's specifically that Project Divert program that I mentioned. And then we also have Lauren Nichols. Lauren's a licensed clinical social worker and a licensed addiction counselor, and she is a school health professional at East High School. So thank you all so much for being here. And I'm going to turn it over to Megan.
Awesome. Thank you, Leah. So my name is Megan Michio, and I'm the school health professional at Thomas Jefferson High School and on the training team 2 days a week. And I'm going to talk today just about the data and the Healthy Kids Colorado survey. So this survey is Colorado's only comprehensive survey on the health and well-being of youth. And the purpose of this survey is to better understand youth health and the factors that help young people make healthy choices. So many school districts use this survey with middle and high school students. It's administered every odd year. So we actually will be doing it again this year for 2021. And we use this data to inform the creation of programming, support student and academic success, provide direction for schools and communities to address health issues, and inform parents on relevant topics to help them talk to their children about health and well-being. And so again, we also use this data to help secure funding so we can be able to do these awesome programs. And the next slide, Leah, thanks. So why this data is important is, oh, there they are. So youth who know their parents think underage use is wrong are 72% less likely to use cannabis. Youth who have an adult to go to for help with a serious problem are 30% less likely to use cannabis. And one of the questions that's noted in the Healthy Kids survey is it asks, do you have an adult to go to for help for a serious problem? And in 2019, 71% of middle schoolers said they did, and 72% of high schoolers reported that they had someone to go to for a serious problem. So that's great news. And then that third bullet point, youth who think their teachers notice they're doing a good job are 28% less likely to use cannabis. Next one, Leah. So this slide shows the survey asks students if they've ever used a substance. And so it's broken down by cigarettes, vaping, marijuana, and alcohol. So you can see those numbers for middle school, what they reported in 2017 and 2019, also what they reported for high school in 2017 and 2019. And one note that when you look at cigarette use, it went up in 2019. And I think that actually just had to do with the way they worded the question. In 2017, they asked how many of you have smoked a whole cigarette. And so that's where they got that number. And in 2019, they reworded the question a little bit. And they asked how many students have smoked a cigarette, even if it was 1 or 2 puffs. So I think that's actually the reason that number went up. But you can see that vaping, marijuana, and alcohol are the higher of those substances. So the next slide. So we also look at perception of harm with substances, and we want to see this number going up. And you can see that in 2017 and 2019, cigarettes have still remained the number one when asking students, do you think this is a harmful substance? And cigarettes comes number one. You can see in 2017, vaping was down to 43%. And that actually makes sense based on when we were seeing a lot of marketing around vaping products, that they were less harmful. And so the perception of harm, and even when you would ask students, they did not see vaping as very harmful. Our program started the 2017-2018 school year, so we started bringing in a lot of our prevention services into schools. And so the nice thing is in 2019, we saw that number go up pretty great, up to 70% of now seeing that, yeah, vaping is harmful. Alcohol has remained the same, and then same with marijuana. They still don't see marijuana as harmful as some other substances. So the next one. So this, I wanted to pull out in terms of data, because I think as when talking to young people, just also looking at that perception of harm and what behaviors they're doing. So from 2019, this is the specifically high school data across the district from Healthy Kids. But you see the perception of harm for alcohol is at 68%. and the perception of harm of marijuana is 42%. And there was an interesting correlation that with alcohol, the perception of harm being higher, that red box, 7%, it was asked how many of you drove while under the influence of alcohol in the past 30 days. And for alcohol, it was about 7%. When you look over at marijuana, the perception of harm is a lot less than alcohol. And we saw a higher number of students reporting driving under the influence of marijuana. So again, I think that's also just an interesting note to keep in mind, that students are seeing marijuana as less harmful. So it's making me think, do they think then it's okay to drive while under the influence of marijuana? And we know that with marijuana, your reaction times can be slower, and your depth perception can be off. So again, just making sure, talking to students about that, it's actually still dangerous and illegal to drive under the influence. The next slide. So these were just some bullet points that I pulled out for the Healthy Kids data, but percentage of students who used alcohol or drugs before or during school, once a week or more, was at 10%. This was for high school. Percentage of students who have seen ads for vaping products in the past 30 days, that's 72%. So again, just as another talking point, we know a lot of students have seen advertising for this. Healthy Kids also asked percentage of students who think their family has clear rules about drugs and alcohol. It's 87%, so that's pretty great. And then one of the last questions that the survey asks is percentage of students who talk to a parent or guardian about the dangers of tobacco, alcohol, and drug use during the last year. And we see that sitting at 50%. So yeah, you can do the next one. I think that actually was my little spot on the data. So I'm going to turn it over to Omar.
Thanks, Megan. Before we move on, there was a question in the chat, Megan. Ellen asked, while you were talking about the mid 2000 teens data on the increase in substance use, the question is, has alcohol changed since the legalization of marijuana? So I want to give you a chance to speak to that before you jump off, if you have any information about that.
Yeah, I'm curious if you mean like, has the rate, like the number of alcohol use gone up? I
would guess up or down. Has it changed at all in correlation with the data on students or youth using other substances?
That's a good question. Yeah, that's a good question. I'd have to look at some of like longitudinal data to see if that has changed since the legalization of marijuana. That's a great question. But we'll definitely look into that, especially looking back at Healthy Kids data.
Thank you so much, Megan. Hi, everyone. As it says on the slide here, I'm Omar Reyes. I'm the community mobilizer and project manager for Project Divert. I'll tell you a little bit more about what that is in just a moment. But essentially, as a district, if you've been following certainly the headlines in the last couple of election cycles, the last couple of decades, we know that there is an emphasis on creating a more equitable school system for Denver students and families. So that's how Project Divert and I joined the substance use and prevention team with DPS. We specifically try to increase, our project is a project specifically meant to increase equity for DPS students by promoting alternatives to suspension, specifically around suspensions for substance use infractions. So possessing vape pens, for being intoxicated at school, for possibly distributing, which I haven't really seen so far this year. So this is in a big picture sense, really what our project is about improving equitable systems in the entire city for the entire school system. In terms of promoting alternatives to suspension, we know that trauma and substance use science tell us that suspensions don't necessarily work in the way that we hope they would. So historically and traditionally, students have been suspended from school when they do something wrong. The unstated reason that we would suspend students when they do something wrong against the community is that we want them to change their behavior. Well, trauma science and substance use science show us that that doesn't actually happen when we suspend students. They don't act, that doesn't really impact their substance use behavior. So what does work and what is more effective are programming that supports a student needs. So that is when students misbehave or they act out, they have infractions, whether it's for substance uses or other infractions, that behavior is telling us something. It's telling us that the student has some need that's unmet. And in prevention science shows us that the way to meet those needs is actually for schools to work more closely with families and students to figure out like what are the unmet needs and how do we as a school community begin to meet those needs. So we want to, in Project Divert, we want to align substance use diversion and intervention with what the public health model says. So the Colorado Department of Public Health and Environmental Practices has funded this program, Project Divert, as a way to use prevention science and use what the state understands to be best practices for helping students facing substance use concerns and families facing substance use concerns. So really what we're trying to do is use what the science says is effective at meeting those needs. The CDPHE recognizes that, risk factors like poverty and trauma, et cetera, are factors that push kids towards substance use. Other factors are protective factors that help kids to avoid substance use. So that is like Leah and Megan mentioned earlier, do students have adults that they feel comfortable, that they feel they have strong relationships with, that they can go to it for advice, that they can talk to about the problems they're facing? Those would be protective factors. So what we want to do is address the risk factors and the protective factors in order to create a more equitable school system. So down to the next bullet, Project Divert, that is discipline intended to value, empower, and restore and train students about substance use and its consequences. Our project is really about wrapping around students and their families and helping them, first of all, valuing them and not excluding them and not saying, you're not part of our school, you're not part of our community, we want you to go away, because we know that doesn't work. Rather, we want to value the student, bring them closer, make them feel like they have important relationships with the folks at school and their families and so forth as a protective factor against substance use. And from there, we want to empower those students to understand their substance use and understand their growth and human development and restore those relationships at school and in the community and show the students like what is happening in their bodies, what's happening with substances, what's happening in their communities, all those ways to build relationships, again, to hold the students closer, not exclude them, because we know exclusionary disciplinary policies are inherently inequitable. From there, it's our hope, our goal to improve equity by eliminating the discipline disparities that disproportionately affect students of color. So that is to say, if we go back to when I first started speaking, as a district, Denver, as a community, we know that exclusionary disciplinary practices are disproportionately used with students of color. So if we want to increase the equity of the school system, we need to make sure that we're building systems that alleviate and ameliorate those disparities. So we, again, want to use the prevention science and the data and best practices to inform what we're doing as schools and as a school system to kind of build in more equity as opposed to create more inequity. So that's our goal with this Project Divert program. So we hope to alleviate disparities in school discipline, particularly demographics disparities. So disparities around students of color being more likely to be impacted by discipline and other school practices. An interesting part of my program, Project Divert, is that we are also seeking to build a community-based coalition. We want to reach out to parents and community stakeholders, students, and actually form a team of people that influence how schools are implementing their discipline policies around substance use. So that is, we want our project to be driven by public input. What do you think? What do you want for education of your students and your kids and your families? What do you want for support around the substance use concerns your families have? And so to that end, I'm the community mobilizer for that project, and my phone number is here. And also, I really can't emphasize this enough. DPS has a department. I was up there the other day. There are 6 people working in this division to answer calls from the community and answer calls from parents and families and so forth. And so that's called DPS Family Constituency Services. There's a hotline. We'll get you that information, and you can also look it up on the web. If you reach out to those folks, they can connect you with me, or they can, if you have concerns around substance use or around discipline, you can reach out to them, and they will be able to put you in, connect you to the right resources to help you. So I am going to turn it. I'm also drop your questions. If you have any for me or Megan or anybody else, drop that into the chat, and we'll try to answer those as we go along here today. So thank you so much.
Hi, I am Lauren Nichols. I am the school health professional at East High School, and I am really excited to talk with you all today. So my job is to talk with you about the brain and effective prevention, and leave you hopefully with some helpful strategies and tips on how to talk to your kids at home. And so to understand, I think, why it's different for teenagers to be using drugs, why we do prevention, and then what is effective prevention, it's helpful to start with kind of that basic understanding of the brain. And so many of you might know this, but the brain isn't fully developed until about the age of 25 to 30. So even at the high school level, I talk with kids about how that prefrontal cortex, that's the last part to develop, is really only about halfway there, learning how to really fully do its job. And that part of the brain controls things like planning, prioritizing, organizing, judgment, decision-making. And so I ask kids, do you feel like you're not great at those things? Good, you shouldn't be. You're still learning, and that's really important. And so we'll talk a little bit about a few different pieces of this, but one thing I always talk to kids about is the fact that they're still in a critical learning period. And so understanding these roadways, you can see these images of roads, but these roadways that they're creating based upon things they teach themselves do matter. And that right now, as they continue through high school or whatever age they're at, they're developing really amazing roadways. They're learning new skills, they're learning new languages, they're learning how to play instruments, all these amazing things, but that their brains will also create roadways if they're using maladaptive coping skills like smoking every time they're stressed. And so we really help them understand what they're doing matters. And that will continue to come back. We can go to the next slide. Sorry, I had someone knock on my door. And so to really understand, yes, the critical learning period is a huge part of understanding why that's different and how their brains learn very quickly what it should remember. That matters. But this is also a really, I think, helpful image of understanding why teens are more likely to experience addiction or more quickly get sort of hooked on to substances. And that's that limbic and reward system. And so what drugs do is they light up that reward system. That's why people like them. That's why people get addicted to them. And with that prefrontal system really not being fully developed yet, while the limbic system is at its peak, just creates a place for kids to really get hooked on to that feeling of that reward, while their judgment and decision making and all of those other things are still learning. And for example, like THC, most of those receptor sites are in that prefrontal cortex. And so also helping kids understand and empowering them of exactly what a substance is doing in their brain, how it's affecting them in the immediate, how can it affect them long term, is all really helpful. And that's something that we do as part of our program, is provide kids with a lot of psychoeducation so that they can make informed choices. Go to the next slide. Perfect. So I love the program we work with a lot in some of our schools called Sources of Strength, and they utilize a model called upstream prevention. And I think it's really helpful because they tell a story about how basically there's a village that's next to a river, and this woman who walks the river every day hears a splash, and then she sees a child in the river and has to jump in and save them. And every day it keeps happening. And so she, rallies everyone and says, we have to look out for our kids. We have to help them. We have to save them. We have to get them out. We have to keep them safe. And so they do everything they can, but some kids still go over the waterfall because it's just too much. And so she starts walking upstream, and they all say, where are you going? Like, we need you here. We need you now. You can't just leave. And she said, I'm not leaving. I'm going upstream to try to figure out why they have, oh yeah, the wrong person on video. I don't know why my face isn't showing. But she said, we're going to go upstream to figure out why are they falling in the first place. And so really understanding the idea, and through a lot of the amazing programs that we do, is the ability to give that upstream prevention model where we are teaching kids all different types of prevention skills, not only psychoeducation about substances, but also regarding life skills, how to deal with big emotions, how to cope effectively. And then through our models in the different schools, our goal is that we have different programs that sort of fit all of these stages. But the more upstream prevention we can do, the better. I'm ready for the next. And so just continuing with sources of strength, I think that the sort of wheel or net, however you want to look at it, really helps us understand what effective prevention and upstream prevention can look like. And so the theory is that the more strength that a child or a person has in all of these areas, then the more safe and holistic and healthy and successful and resilient they will be. So if a student is really great at basketball, loves basketball, but has a parent die, basketball is not going to be enough to keep them safe and help them be resilient from that situation. And so making sure that the more we can really create this to be a holistic net and tether together all of these strengths for our kids is really helpful. And so we do this in many of our areas, but these can look a lot of different ways. We talk with a lot of people that family support might also be a parent's best friend. That might not be your blood related relative, but maybe you're really close with them. Mentors, anyone really that's older than them, and a healthy mature generosity. Spirituality doesn't have to be religious organization, and if it is for your family, obviously that's great, but it can also be many other things if you don't identify with religious as spiritual. So you can also think about how you feel connected to essentially something greater than yourself. Maybe it's going for a walk together or getting out in nature or anything like that. And so with understanding I know that was fast, but a bit about the brain, a bit about understanding how upstream prevention and all of those different pieces work together, I wanted to make sure that you feel like you're leaving today with some really specific tips. And so this is from one of our parent sessions when we work with kids individually, but 6 effective strategies to communicating with your child. So I care, I see, I feel, I listen, I want, I will. I care, that could sound like, I care about you, I don't want you to get hurt, rather than, you're being dumb, this is dangerous, don't do that. Really referring back to that I see and I care, I don't want you to get hurt. I see is when you're working really hard to be objective. The example that sometimes we give regarding students who are using substances is, if your child comes home under the influence, it could be tempting to scold them or try to talk to them in that moment. But instead, maybe waiting until they are sober and then very objectively talking to them about, I saw you come in at 2 a.m., your eyes were red and you were stumbling. I feel is just letting them know how you feel. I really care about you. I love you. I'm worried about you, and I don't want you to get hurt, or I don't want your success to be impacted. I listen, making sure your child knows that you will listen and that you want to talk to them, but also being mindful again of not having these important conversations while your child is under the influence, but letting them know you are there and available when they're ready to talk. I want, really conveying to them what you want them to do. So for example, I want you to set up another session with Miss Lauren and talk to her about your use. And then I will, making sure that your child knows how you will support them. I will help you find a therapist. I will drive you to therapy. I will contact Lauren and ask her to pull you, whatever that looks like in your household. But then making sure that you're following through on what you say you will do for them as well.
Okay, so thank you 3. That was wonderful and amazing, and also a lot of information all in a short period of time. So we want to give you all as attendees a couple minutes to ask questions. So please feel free to enter those in our Q&A section, and Lauren and Omar and Megan will answer them. Omar and Megan, do you want to turn your videos on? And I will start just reading off the questions.
I need permission to turn my video on. Sorry.
Oh gosh, I'm so sorry, everyone.
It's okay.
Has there ever been a time when something has worked without needing some sort of technology issues? Okay, so our first question is, how has adolescent alcohol and marijuana changed since the legalization of marijuana? Megan, go ahead.
Sorry. I was trying to actually drop in a link. Maybe I can do it on the chat here. The Colorado Health Institute has a great snapshot that shows some data between 2013 and 2015, and marijuana was legalized in 2014. So we've seen that alcohol it's actually always been like the #1 substance that students report using. When marijuana did become legal, we actually didn't see an increase in teen use. One thing we saw was the age at which youth were using. So we started seeing that that was happening a little bit younger, but we didn't see a major increase of marijuana use, which was good. But unfortunately, alcohol has still been like the #1 substance that students report using. And I did also drop some other links in the chat. Hopefully everyone can see, but there was a teen driver source that again talks about risks and things, impaired driving, and it kind of goes into other legal aspects of it. One things that we talk to young people about all the time is, because marijuana is legal in Colorado, also how that can affect financial aid. So schools really push for students to fill out FAFSA for financial aid, but marijuana is not legal on the federal level. And so that can be a really big deal when applying to colleges, or really just anytime you're trying to apply for federal funding. So that information is in there.
Thank you, Megan. And yeah, one more point about the marijuana piece since legalization is that, yeah, it has stayed pretty steady across. So use hasn't changed a whole lot since it was legalized in 2014, which is unfortunate. We'd love for it to drop, but I think the expectation was that use would increase after legalization. So we do look at it as a slight win. And we're hoping that it will decrease as that perception of harm continues to increase, which it is. Okay, so the next question is, can you talk about how to educate teens about the high potency in some forms of marijuana?
I can take that one or start. I think that this is a very important topic. I actually had a student this year that was diagnosed with drug-induced psychosis from potency THC. And so I think that it's in one way difficult because we don't necessarily have a lot of research to fully understand why is high potency potentially more dangerous. But there's definitely a lot of various risks that come with it. I think that, again, really objective scientific education is a great way to do it, and to help your student or your child understand how to find accurate data. That can be difficult. If I want to find data that says sky is green, I'm sure I could. So kids see a lot of misinformation out there, and so helping them figure out, where do I find objective data, and then helping them really get that scientific information, ultimately the way I would do it.
Thank you, Lauren. Yeah, and another thing I think that we talk about a lot when we're talking with youth is, and with parents, is that the marijuana with dabbing and other forms of really, really concentrated marijuana is at such high THC content. A lot of the marijuana that was around in the 80s was around between 2 and 5% THC. And now some of this is in the high 90s. So a huge difference, and we just don't quite know what the long-term impacts of that. And like Lauren mentioned, is that there are a lot more not so great short-term impacts of that high potency with marijuana as well. Okay, so another question. How can my kid find an SHP in their school? Who can we reach out to if our kid needs help?
Well, usually, let's see, do we have, Leah, I don't know if there's an easy list to see which schools have an SHP. Like Leah mentioned, we're in 26 middle and high schools. So if you connect with your mental health team at the school, they should be able to tell you if you do. If not, part of our role also on the training team is to be able to train staff on some of our prevention programs if they do not have a school health professional. So I, for example, just went out to a middle school last week that does not have a school health professional, but we were able to train some of the staff on some of our prevention programs.
So
But also,
even if, Megan, that's to say, even if your school does not have, your child's school does not have one of our SHPs, it is the content and the training required to deliver our substance use programming, our intervention programming, is accessible to all the schools. They can make a call to our team and we can send trainers out to train their staff on how to implement these interventions.
yes, that is correct.
Thank you, Megan. Okay, so another question that we have is that if a student does the Teen Intervene intervention, does it make sense to also suggest a mental health intervention?
I think that, you know, working really closely with the mental health team and the school counselors is really important. I think it can be, you know, we see very different levels of teen intervene. So I think it's also kind of case by case basis, and hopefully the mental health team and the counseling team at that school can sort of like, you know, wrap their arms around that individual student to see is more support needed, and what does that look like?
Thank you. Next, oh, go ahead. Oh, sorry, I thought I heard something. Okay, so the next question is that teenagers' lives are so stressful. What are some strategies to help kids cope? What are DPS schools doing to give kids these skills?
I feel like Lauren would have some good stuff, but I know her audio is choppy. So Lauren, if you're also typing stuff, that's awesome. Again, I think, you know, it can be a school by school decision. I will say DPS as a whole, so even from the very top, has said we need to incorporate more social emotional learning into schools, and every school should be doing that. So you know, for example, at the school I work at Thomas Jefferson, we now have an advisement class that's 2 days a week. And kind of the nice thing about that is it's not an academic class, like, so that gives us the opportunity to put in things like we use the asset curriculum, which has awesome 5 to 10 minute strategies on how to cope with anxiety and how to cope with stress. And they're really quick tools so that students can sort of build that, so they can just build extra stuff in their toolbox to figure out what works for them. But I know there's a lot of schools that have other, you know, awesome programs. We do for small group and individual work, we use a curriculum called Coping Cat, or the CAT project, to really focus on students who are struggling with anxiety. And again, we kind of get those referrals based on either parents or teachers or mental health providers. And so that's how we get some of that information to figure out how to support students.
Thank you. I think those are all such great resources. I think also kind of looking back to that wheel that Lauren shared, and looking at all the strengths that a student can check into, acknowledging that every student has their own unique strengths and their unique, I thought Lauren was like doing a strength thing right there. But yeah, so checking in with them on that, and checking in with them on what their own passions are, and what they're interested in getting involved in outside of school to help with some of those stressful things they have going on. Okay, next question. My kid is not comfortable seeking help at school. What resources are available in the community to support kids?
I'll jump in here. I don't have a comprehensive answer to that question. But as a community mobilizer, just a moment ago, I dropped my information in the chat, and the helpline, the DPS Family Constituency Services helpline into the chat. That's a 720 phone number that you can call out with any questions and any concerns. If you feel like there's something you need that you're not getting as a stakeholder for the Department of Public Schools, Denver Department of Public Schools, then you can call that number and they'll open a case for you, and they will try to connect you to the resources that they'll try to figure out what resources we have that are available and connect you to the folks that can deliver those resources to you. So that phone number, everybody here should be taking down that phone number, just, in case, even if they don't have anything on their plate right now, something happens later in the school year, you have a question about, a concern about, the FCS helpline, that hotline can help you figure out, like, who do I need to call when I have this or that problem? So I encourage you to write that number down.
Thank you. And I think you both kind of touched on this, but the last question, or the next question that we have is, I'm wondering if the parent who asked what to do if their kids need help, did they get their question answered? I know you all talked about the training that you can provide teachers and staff, but what can parents do the same day or the next day when they realize they need to get support for their child? So Omar, you talked about that hotline, which is great. And I know Lauren put the STEP program and Denver Health in the chat. Are there any other great resources?
Yeah, I was going to say, find out if your school has a school-based health center. So they're run by Denver Health. So what's great about that is there are providers that work within the Denver Health Clinic in the actual school. And if your school doesn't have one, any DPS student can access one of the school-based health centers and work with a therapist through there. But also because of Denver Health, like we are a great partner with Denver Health and they have a lot of great resources. I know Lauren put in the chat, MHCD, so Mental Health Center of Denver. There's a lot of those locations around Denver. There are also, we always tell students about Safe to Tell as a resource. The Trevor Project. The Trevor Project is specific for LGBTQ youth who are struggling. What other? And we can make sure we compile all of these resources and list them in our follow-up email that we send. I'm trying to think of other specific.
I can jump in here, Megan.
Yeah.
Really, for folks that have, concerns about what to do today to access resources around my kid, particularly if it's substance use involved at school. So my kid gets sent home, or I get a call from the school, they're intoxicated or they have drugs or something like that. For all of these issues, your first avenue of support is going to be the mental health team at your child's school. So your school, most likely your school has a school social worker and or a school psychologist or other school mental and behavioral health supports. So you can find out who those people are by contacting your principal or your vice principal. Or maybe you already have that relationship. Maybe you're getting the call from the restorative justice team or from the principal, and you're not sure what to do about your kiddo. You might want to ask about, can I talk to the school social worker? Can I talk to the school psychologist? Can I talk to someone on the school mental health team? So that that professional will be able to point you in the right direction in terms of the resources provided by the city and the county to help you that day. What do you need that day right then to support your student, your kiddo?
Thank you all. And there's a good list going on in the chat. If anybody in the audience has some more information, I would love for you all to put those in the chat as well. And we'll compile those and put those in our follow-up email that we'll be sending out tomorrow. And additionally, of course, if it's an immediate concern, you can always call the call. I mean, if it's an emergency, always 911, but if it's an immediate concern as well, you can also call the Colorado Crisis Hotline. Let's see. We have a question in the chat. What are some warning flags or warning signs or red flags parents should look for besides the obvious intoxication?
Yeah, that's a great one. And sometimes with vaping specifically, it can be really hard. One, there's not really the smell associated with it, especially since it's a lot of fruity flavors with vaping. But noticing any like behaviors of withdrawal. So like if there's something they're really into, like if it's a sport or band or a club that they're involved in, and maybe they're not participating in that as much. If there's like a group of friends that they always hang out with, and maybe that's changed, they're sort of pulling away from hanging with them. Lauren put in the chat, yeah, disengaging from school, family events, and things like that. Because yeah, sometimes you don't notice the typical unless they're intoxicated and things are changing. So yeah, but I will say with vaping though, again, even if you do notice those fruity flavors and that's something that's all of a sudden brand new, that could be something because a lot of them are vaping some of those, the really fruity flavors. And that can be really hard to detect. So yeah, hopefully that helps a little bit.
Thank you. Those are all of our questions right now. Again, we will send out a follow-up email with these slides, with this recording. You can find our past recordings on our website at dpsprevention.org/webinars. Our next webinar in our series will take place the first Wednesday of November, which I believe is November 2nd. And we will have Levi Atherson from DPS coming to present on how to be an ally to transgender youth. And then last, we have a very, very, very fast follow-up survey. I'm dropping it in the chat now, and I'll also send that up in that follow-up email. It's 3 questions, just asking thoughts, suggestions about this webinar. And then also, if you have any suggestions or things that you would like to see in our future webinars, that would be great. Thank you. I had the date wrong. It is Wednesday, November 3rd, not November 2nd, because that is not a Wednesday. We will all stay on for another 5 minutes or so. If anyone wants to unmute and ask or raise their hand, I can unmute you and you can ask some questions. Otherwise, thank you so much. Have a great rest of your day. Does DPS Space have a website page that lists multiple community resources? And this could be really helpful moving forward. So our team, and I've dropped it in the chat a couple times, I'll drop it again, dpsprevention.org. We do have a resource list there. We make sure to update it at least yearly. Omar, did you have any other suggestions about where people can go for good resource lists?
Yeah, I'm about to drop into the chat the FACE homepage. So FACE stands for Family and Community Engagement. So DPS's department that houses that hotline is called family and community engagement. That hotline is listed on the webpage, and I'm going to drop in the link to their webpage. And they do not have a comprehensive list of resources on their webpage, but they do list some resources. And like I said, it's a hotline, so you can call if you have a concern and just ask them. They'll take your number and your name. If they can't answer it right away, they will build a case for you and get right back to you, or steer you to the department that can help you. And I'm dropping that in now.
Thank you, Omar. And Jenny just asked in the chat, what are some other protective factors that parents can provide to their kids?
Connection. So there was a question earlier about how do I tell the signs of substance use for my kiddo. The best way to do that is by having a strong relationship with your kiddo. And obviously, as they become adolescents, they begin to disengage anyway, and they seek more independence anyway. But if you are creating a relationship with your kiddo where you're actively, asking them, what's going on with them, how are they doing, and it's much easier said than done, of course, but through your relationship with your kiddo and letting them understand what the family values are, and teaching them the family values and expectations from a young age. Obviously, it's easier to start when they're little than it is when they're 15 or 16. And I'm not the only person with expertise in this, so I will let other folks answer as well.
Yeah, I think, one of the resources I dropped in here was the website from Forward Together Colorado, which has some really great specific talking points. Because one of the questions that came up in the Q&A was, what do I tell my student about my use if they ask? And it was just, kind of reminding parents and guardians to, it is up to you how much you want to share, but also really focusing on that, focusing on your student and what, and also that this is not going to be a one-time conversation. So reminding them that the door is going to be open so we can continue to talk about this. But it does kind of go back into reminding them that, their brain is still developing. And as an adult, my brain is fully developed. And so when I make decisions, if it's around substances, my brain is fully developed to make those decisions and balance out what's healthy and not healthy. And yeah, again, just I think reminding them that we're going to continue to have this conversation. This is not going to be we're having the talk right now. But reminding them that they can always, that they're always open, because the one stat showed, it's over 70% that have seen ads on vaping. So sometimes that can just be as you're driving along and you see something or hear something on the radio, can be a good opportunity to chat about it and just see what they know. It's interesting when you do talk to students about just also what they find out, what they know about it, what they know about alcohol, marijuana, vaping. Yeah.
Thank you both. All right. Thank you so much, everyone. Thank you for being here. I so appreciate you all taking the time out of your day to join us.
Thank you. Yeah, yep, and we'll follow up with some great resources. And yeah, if you get a chance to fill out that Google form, that would help us out tremendously. Thank you. Yay. You're on mute, Leah.